I'm Cardinal Health LiquiBand OCTYL Topical Skin Adhesive. Today, VAT committee members make their decision on topical skin adhesives. I'm prepared. I want to show that I can go the distance.
Okay, we finished our trials, and you've all seen the data on all the OCTYL topical skin adhesive products, including our current one. We want to standardize hospital-wide. So what are your thoughts on the products? Can we make a change?
Cost savings is important, but we need to select a product that dries within 3 minutes. One product we evaluated this week seemed to take forever to dry, so the patient is under anesthesia longer, and we're waiting around for the OR.
Customers said set time was a critical property. That's why my data was tested by an independent lab and found to be very competitive, falling well under 3 minutes.
Just because we didn't catch up.
I've read the product studies. Some have better wound closure strength than others. For the OR, I'll only endorse a product I think has good wound closure strength so we avoid any possible dehiscence.
I had to prove I was strong. Testing showed that there's no significant difference between my wound closure strength and the major competitor. And when up against that same competitor, testing showed I'm actually stronger in tensile and lap shear strength.
Sue, I'm sorry to interrupt you, but I know that Kate has to get down to the ER, so.
Our current product can cause an exothermic reaction, so we don't use it in the ER often. Based on that,
the same independent lab found I have a lower exothermic reaction versus some competitive peers. This is great to know, especially when I'm applied to a child or to an adult patient treated outside of the operating room.
but there were some other good choices in there.
I really liked the wings on the Cardinal Health product. It was nice in my hand, the ampule cracked really easy, and it was easy to use. And the viscosity was good enough to stay in place. I could do a thick line or a thin line, and it covered completely. The wings actually helped it expel the adhesive completely.
It also looks like you're
I
getting
was
a lot of
designed to be
adhesive in
simple
here
to
for-
use and to apply adhesive in a controlled manner. My wings are an important feature in that design.
The product has to have enough adhesive to cover the incision. When we were testing the little applicators, I was forever cracking them. There wasn't enough adhesive. Or with the pen style product, the adhesive dried in the applicators before I could use them.
Which was the product we tested last week that dried quickly on the skin but not in the applicator? I remember over an hour later we were still able to apply adhesive to the patient.
That was the Cardinal Health product, the LiquiBand OCTYL. That was a pleasant surprise. I think we could use one of those on cases where we've been using 2 of our current product.
The blue one with the wings, yeah, I really liked that one. It worked well with my long incisions and my laparoscopic procedures, and it was usable the entire time. I know you said with the smaller units it would be less expensive, but if I use so many in each case, is that really true?
The savings were based on 1 applicator per case, so if you're using more than one, we might not be saving. It could actually be costing us more. So if you
That was by design. Independent testing showed that after my ampule is cracked, I can avoid drying or clogging in my applicator for up to 90 minutes. And when applied to the patient's skin, my set time is still about 1 minute. That's what I meant by going the distance.
look at potential savings if we convert to the Cardinal Health product.
Well, and the product also has more adhesive than others, so we're not having to use multiples per case. If we standardized hospital-wide.
I'm packed with 0.8 milliliters of OCTYL adhesive, which covers a lot of ground. The independent lab said I offered the highest level of surface area coverage. Combine that with good economic value, and well, I think they should see the value of selecting me.
Okay, I think we've made a choice. Cardinal Health LiquiBand OCTYL Topical Skin Adhesive. It's easy to use, it's got good dry time, good strength, low exothermic reaction, so we can use it in the ER, and great utilization and economics. I think we're done here.
Let me go the distance for you and your facility. To place an order or for more information, please contact your Cardinal Health sales representative. Call customer service at 800-964-5227 or visit cardinalhealth.com.